When the diaphragm contracts, lung volume dash A. Increases. B. Diffuses. C. Decreases. D. Compresses. The answer is A. Increases. The diaphragm is a thin sheet of muscle that separates the thoracic cavity from the abdominal cavity. At rest, it is drawn upward into a dome-like shape under the lungs. When the diaphragm contracts, the dome flattens out, which increases the size of the thoracic cavity. The negative pressure allows the lungs to expand and fill with air, causing an increase in total lung volume, inhalation. What chamber of the upper respiratory tract is shared by both the respiratory and digestive systems? A. The pharynx. B. The soft palate. C. The esophagus. D. The sinuses. The answer is A. The pharynx. The only chamber of the upper respiratory tract that is shared by both the respiratory and the digestive systems is the pharynx. The pharynx is the part of the throat that is immediately posterior to the mouth and the nasal cavity, and superior to the trachea, larynx, and esophagus. Which of the following is not a division of the pharynx? A. The sonopharynx. B. The oropharynx. C. The nasopharynx. D. The laryngopharynx. The answer is A. The sonopharynx. The pharynx is made up of three divisions: the laryngopharynx, the oropharynx, and the nasopharynx. There is no portion of the pharynx called the sonopharynx. Which of the following pairs of sinus is absent at birth, and is not fully developed until puberty? A. The ethmoid sinus. B. The frontal sinus. C. The sphenoid sinus. D. The maxillary sinus. The answer is B. The frontal sinus. The frontal sinuses are not present at birth. They begin to develop in the first few years of life, but they are not fully mature until after adolescence. The sphenoid, maxillary, and ethmoid sinuses are present at birth, though they are underdeveloped and similarly do not mature fully till late childhood or adolescence. Which of the following is a flap of cartilage that covers the opening of the windpipe during swallowing to prevent aspiration? A. The cricoid cartilage. B. The hyoid. C. The tracheal cartilage. D. The epiglottis. The answer is D. The epiglottis. The small flap of cartilage that covers the windpipe to prevent aspiration during swallowing is the epiglottis. It is located at the base of the tongue and attached to the entrance of the larynx.